Do you have an issue with a small chin? Well, if you do, I've got some great solutions in this segment of your pre-consultation. So let's get started by defining exactly what is a small chin and why treating a small chin is so important to how we look. So a small chin basically is a chin that we diagnose very simply. If you take a picture of yourself in the profile view, meaning from the side, and you take a line that goes perpendicular to the ground, and you take that line and you go straight from the most projecting part of your lower lip straight to the ground, a male chin should project to where that line is. You can see on that picture on your left of a man and that straight line coming down from the front of his lower lip and his chin not projecting anywhere near where that line is. For a female, you take that line and you just alter it a little bit, okay? Because a female chin does not necessarily need to project as far as a male chin. So on that picture just above me, you can see up there that female where you have that line is just projecting a little bit behind. That line is not kind of completely perpendicular, but it's maybe 10 degrees off, and you can see her chin does not reach where that line is. And so that's kind of the definition of a small chin from the side. In a male, you should have a line coming straight down from the front of the lower lip, and the chin should project to where that line is. In a female, it should project just behind that. So what's the goal of why would we even bother treating a small chin? Well, the goal of treating a small chin is to create better harmony for the face. And what I mean by this is a small chin is kind of the same as like a big nose or a bump on the nose. It draws attention to it, and it draws attention away from the more attractive features that somebody has. So for example, you may find somebody that has really pretty eyes, really nice cheekbones, and a small chin. And when you look at that person, or she or he looks at themselves, all they see is the chin because a small chin draws attention to it. So therefore, the goal of treating a small chin is not necessarily to make the chin look oh so beautiful, because really people don't have beautiful chins. You don't know of anybody in Hollywood that's known for the most attractive chin. But the goal of a good chin is to not draw attention to it and to allow other parts of the face that are traditionally considered more attractive, like the eyes, like the lips, like the cheeks, to draw attention to them. Okay, so I hope that makes sense. So by having a small chin, it throws the harmony of the face off by drawing attention to it and taking attention away from the other more attractive features of the face. Now, as we go through this pre-consultation, you'll see exactly what I mean by some of these photographs. Well, if you've got a small chin, a very simple way to treat it is to use a non-surgical treatment like a filler. Okay, and so the fillers that I recommend at YPS that we use for the chin are all hyaluronic acid fillers. I don't recommend any non-hyaluronic acid fillers for the chin. Typically, the two that we use most commonly are Restylane Lift and Restylane. The hyaluronic acid is injected in multiple small pokes along the chin, exactly where we want to put it, and placed literally right over the bone. Okay, and by doing that, it can cause that chin to project just how much we want it to. Juvederm is a second-tier choice. I love Juvederm, don't get me wrong. We love it for the lips and for nasolabial folds, but it's not my top choice for the chin because Juvederm is actually somewhat soft, and for the chin, we want something firmer that feels more like bone. And for that reason, I recommend Restylane Lift. Or regular Restylane. I don't recommend any non-hyaluronic acid fillers like Radiesse. We don't use that at YPS because I want something that I can dissolve away if for some reason we're not happy with it. So once again, a filler injection in the chin is a great way to fill that chin out and get an idea of exactly how it's going to look. Now those fillers, Restylane Lift, last anywhere from about 9 to 12 months. Regular Restylane is probably closer to 6 to 9 months, although some people believe that when you inject it into an area like the chin, it can last longer than when we inject it into the lips or other parts of the face that move more. The injection is very simple. We just use a small needle. I don't use a cannula for this, but we use a small needle to inject right over the bone, multiple little pokes, put a little pressure on it. You may get a little bit of a bruise afterwards, and that's usually about it. Sometimes we'll use a little bit of a topical numbing medicine, whether it's a spray or a cream. Other times we'll just use some ice or even nothing, depending on what you can tolerate. It's a very well tolerated procedure. You may get a little bit of a bruise afterwards, but you can go right back to work afterwards. It's not that big a deal. And the great thing about this type of a treatment is you can see the results right away. The swelling is quite minimal. Once again, you may get a little bruise from it, a little swelling, but usually it's quite minimal. And what I do when I do these with the patients is I'll inject it, then I'll stop and I'll give the patient a mirror so that you, the patient, can actually see what's going on. And sometimes patients will say, hey, can you put a little bit more here, a little bit more here? And we can kind of do that together and plan the result together, which is actually kind of fun. Well, another option is to use your own fat. Okay, so we can take fat from the tummy or the thighs, purify it, and inject that into the chin. That's another option. Some of the fat will stay, some of it will reabsorb. Probably on average, about 30 to 50% of that fat does stick around. That's another option for you. It's not my top option for the chin just because the fillers are much easier. You can do that in the office. The fat we typically do in the operating room. And if you're not liking the fillers, you want something more permanent, the problem with fat, it's a little unpredictable and it's hard to tell how much is going to stay. So if you want something simple and easy and you're okay with the result that lasts around a year, then go with the fillers. Very easy, no downtime. Usually we would start with 1 syringe up to 2 syringes. Each syringe starts anywhere from $600 or more depending on the filler that's used. Here's an example of a patient who had filler injected to the chin. You can see a nice improvement. This was actually fat used as a filler, and a nice improvement there. But if you are truly looking for a permanent result, then what we recommend is use of a chin implant. So what I use is an extended anatomical chin implant by a company called Implant. And this is a solid silicone implant that's placed right over the bone along the chin. And it's tapered, as you can see. So it's thicker up front and then tapers as it goes out. So the surgery basically is it's a general anesthetic, so you're completely asleep. While you're asleep, I make a little incision on the inside of your lower lip near where it meets the gum. I then dissect right on top of the bone. It's literally 5 centimeters on each side. Make a pocket right between the bone and the periosteum, which is the bony covering. And then we stick that chin implant right along it. It's kind of like a hand in a glove fit. So it fits nice and snug there, so it's not meant to move. After that, wash it out with a little bit of betadine and then put a couple of absorbing sutures in it to close it up. The surgery itself takes about 30 to 45 minutes. Once again, it's done under a general anesthetic, so you're completely asleep. You wake up, you hang out in the recovery room for about a half hour to an hour, make sure you're feeling fine, and then we get you going home. Now, this is not a real painful surgery. You may take a few pain pills the first couple of days, but that's usually about it. We do keep you on a liquid diet for a week because we don't want you to stick a Dorito chip through that incision, so liquid diet for a week. You will have some swelling there, and the swelling will cause you to smile and talk a little funny initially. So initially, if you smile, you're not going to show all your teeth because it's going to feel a little bit stiff. It takes about 3 to 4 weeks to get what we call a permanent full denture smile. You come back to the office at about a week. At a week, we take a look. Everything usually is healing real well. You can start exercising typically after about 2 weeks. Once again, regular diet after a week. And it will take 3 to 4 weeks for the enough swelling to come down that you can smile normally. Although it can take a total of 4 to 6 months for all the swelling to go away. I don't put the chin implant through an incision underneath. Some people do that. I've been taught how to do it through the inside of the mouth, and I like the idea of not having a visible scar from it. So what are the risks of putting in a chin implant? Well, there's always potential risk of bleeding, which is very tiny, and the potential risk of an infection because this is a prosthetic implant, although that risk is extremely small. There is a risk of numbness. I'd say about 50% of the patients will have some temporary numbness right after surgery, and almost all of that will go away. But literally up to 1 in 2 patients will have some type of numbness. There is risks of an injury to a motor nerve. A motor nerve is a nerve that can cause you to smile crookedly. That risk is very tiny, and the vast majority of the time, 99% or more of the time, if that happens, that kind of crooked smile, motor nerve injury will go away. And once again, extremely, extremely rare for this. There's also a risk of what we call bone reabsorption. In some cases, when you have the chin implant over the bone, as the years go by, that bone can actually get a bit thinner. Not something that I see commonly in practice at all, but a long-term potential drawback to putting in a chin implant. What do you do in that situation? Well, you can take the chin implant out and try a filler or fat, or you can even potentially still leave it in there and maybe inject some filler on top of it if it feels like the chin's getting a little bit smaller. But once again, this is not a complication that you see all that commonly. It's kind of a long-term type of thing. Unlike breast implants, chin implants are made to stay there forever. Okay, it's not something that every 10 years you got to switch out. This is something that you want to keep in forever. Those are kind of the main risks that we see with it. There are definitely other potential risks as well, and that's something that we can discuss in a face-to-face consultation or at the pre-operative visit. Well, let's take a look at some patients who've undergone chin augmentation with an implant. Here's a patient before and after. You can see very subtle, okay? The great thing about these chin implants is they come in a small, medium, large, and extra large size. So it's very simple. Most women who have small chins, I use a medium size. Unless their chin is really small, then I would use a large. I'll show you a large size in a few minutes. For men, most men, we use a large size implant. Unless their chin is really small, then I would go with an extra large. Very simple. As you can see, just helps with the harmony of her face, looks nicer. Another patient here, if you look at her picture on the left, she has a smaller chin. On the right, a medium-sized chin implant. And just overall, her face has better harmony. You can see her eyes look like they've been lifted a bit. Her cheeks look more attractive. Her nose looks a little smaller. It's just everything seems to fit better, and that's what I mean by this facial harmony. Now, this next one will really give you that idea. So if you look at her before, on her left side, the chin's a bit small, and I did take a tiny bump off of her nose as well. But the big thing is if you look at her after picture, she looks more attractive there. She looks prettier, and it's because, and not that we did anything with her eyes or her lips, really the fact is putting that chin implant just gets better harmony to her face and actually makes her look like more attractive. And a really good example of this, even from the front, where you think, oh, with a chin implant, do you really see much from the front? You can when you improve a person's facial harmony, and things just match better, and she just looks prettier afterwards. And literally all this was taking a little bump off the nose and putting the chin implant in, and just everything seems to match better. Well, this is a patient who had a large size chin implant, and still her chin's just a touch small. But you can see things match much better. You can see how small her chin was before. And let me show you how she looks from the front. Once again, she looks so much prettier on the after photo, and it's the only thing we really did, took a tiny bump off the nose and added that chin implant. And putting that chin implant really helps to improve her facial harmony. Okay, so a really nice treatment. So if you have got a small chin, or if there, a lot of people who have small chins, they don't even know their chin is small. They just look at their face and they say, there's something about this part of my face that I don't like. Well, take a look at your side profile, and if you've got a small chin, then either injection of some filler or placement of a chin implant can be a great option for you to help to create better harmony to your face, so that the attention doesn't go to your chin, but it goes to your eyes, it goes to your cheeks, it goes to your lips, and your face looks more harmonious. So I hope this makes a lot of sense to you. Chin implants are some of my favorite operations to do because they create such a cool change for people, and it's quite unexpected. The best situations, I get patients that say, there's something about this area that I don't like, and we put the chin implant in, and they go, oh my gosh, you hit it right on the head, and nobody can tell that I've had something done. They just take a look at me and they go, wow, you look really good, and they don't know exactly why. That's a good chin implant or a chin augmentation with some filler. Well, I appreciate you watching this video. Thank you for watching How to Treat a Small Chin.